Hello, welcome to Cat's Got Your Tongue, our feline-friendly podcast in association with the charity Cats Protection. I'm Adam Brown, your host, a self-confessed cat enthusiast. Actually, no, that's not strong enough. A cat lover and a very proud cat dad as well. Now, in each episode of this podcast, we're going to be bringing you celebrity guests who love their cats just as much as we do. And remember, if you're listening to the show, we do have full episodes up on YouTube now. So if you want to watch any of our episodes in full, please head on over there. And as always, we want to hear your funny feline stories and your cat dilemmas. Or maybe there's a question about your cat you just always wanted to know the answer to. Get in touch. You can do that either by email on pod@cats.org.uk, or you can text us, or even better, voice note us on our WhatsApp on 07824 551 076. So let's get into it. So we've already established that, I love cats. If you didn't know that about me by now, where have you been? But, every day is a school day, and we are ending Series 2 with another listener special. And as always, there's always more to know about cats. I'm learning about my cat every single day, and that's why, once again, I've got Nicky, our resident Cats Protection expert, and what she doesn't know about cats isn't worth knowing. That's the best way to introduce you, Nicky.
You're too kind.
What a series we've had, Series 2.
It's been amazing, hasn't it?
We've had some incredible guests. Louise Pentland, we've had Jake Lambert, Lawrence Weller-Bowen, who's very flamboyant, telling us about his cat. Giles Corran, Dawn O'Porter, Jane Fallon, Bob Mortimer, Ellis James. We've had just some incredible guests, and, each guest has brought something a bit different, haven't they, to the table. So let me just tell you about what's been going on in the world of my cat this week, Nicky, before we get into it and get our guest on for the final episode of the series. Of course, my cat Ruby, who you know all about because you solve all the problems for me when it comes to telling you about anything that's going on in Ruby's life. So obviously she's still on the medication for the hypothyroidism. It's all going great. She seems to be gaining weight. Her fur seems way better than it was, and she seems a lot more cuddly as well. She seems to want to be sitting on my knee and be around me all the time, which is brilliant. So
amazing.
It's just, I feel so good about that. One thing that she has been doing recently is missing the litter tray sometimes.
Yep. Now, firstly, is it for urine or poo or both?
Poo.
Okay. No.
Never thought I'd just say that on a podcast, but there you go.
I was debating to say feces. But
right, okay. It's fine. No, I've literally just got, poo.
It's poo. It's important to ask us because they can have different things that could be going on. As with all things behaviour, changes, we have to first of all rule out medical problems. So it is worth discussing with your vet, particularly because it's a new thing that she's been doing lately. So common reasons for medical reasons for the pee to be just poo and not wee would be changes obviously with the poo itself. So for example, if she had diarrhea, I appreciate that a lot of owners are quite good at picking up on diarrhea, but what I find that a lot of people are missing is if it's actually constipation and it's harder to pick up on, but it is a really, really common medical reason for cats to poo next to the litter tray. The other thing to consider is she is 10, right, and so she could be showing early signs of arthritis. So again, it'd be worth discussing that with your vet and seeing if there's any pain related or mobility based issues that's causing her to miss the litter tray. And then if the vet gives the full, medical bill of health for Ruby, fingers crossed, and it could be behavioural, then there's a few things to check out. Now, obviously, I know you're cleaning out the litter tray very frequently. It's all nice and clean, because that's always the first thing we always check out with people. So just for other people listening, it's a case that you need to clean the litter trays out once or twice a day, taking those deposits out. Some cats will literally need it done after every visit to the litter tray and they're not a princess. Everyone says, they're a little princess. I'm sorry, but we flush every time.
Exactly.
So they're great. And then there's a whole checklist. So is the tray large enough? Because a lot of the commercial trays are actually quite small for a cat. It should be 1.5 times the length of the cat. So you can really turn around in there properly. Again, tied in with the mobility thing. If it happens to be a mobility issue, then getting a more senior cat litter tray. I know. I she'll always be a kitten in our eyes, right? I know
what
that.
Are they like?
So we do have one at Cats Protection, and that's where one of the sides, at the front, it's much lower, so they can get in and out much more easily. Because even a few inches, that can make a big difference when their joints are sore. So that's one thing that can be done. The litter type itself is a really common one when it's poo, not wee. And that's because, this is going to be slightly graphic and I'll do my best with this.
Okay, go on. I'm ready.
Ready. I hope everyone else listening is ready. They put more pressure on their hind legs when they go for a poo rather than a wee. and therefore they feel the litter type on those back paws in particular even more so. And therefore, really soft, fine types of litter are preferable than anything that's a bit harsh or, sore underneath their pads. Yeah. So some of the sort of bigger chunks of litter, the cat will just about tolerate having a quick wee. Whereas when it goes for a poo, that's when they will toilet next to it. And generally, if a cat is toileting next to a tray, whether it's wee or poo, it means the cat wants to use the tray, but something's putting them off. And it's about being like a little cat detective to figure out what those things are. So it could be, like I say, tray, litter type, tray size, location's another one. Like if it's like a really busy traffic area, as in human traffic, or cat traffic, and if there's other cats in the house. I know that she doesn't have anyone else in the house. Like if they're overlooked, for example, like cats don't like having litter trays next to glass patio doors, cat flaps, conservatories, things like that. Litter depth is really important, so ideally about 3 centimetres deep. Unscented litter, not adding anything like odorizers to the litter. The list continues.
Yeah.
There is I've got a YouTube video on it, so if you want to check it out on Cats Protection Behaviour Guides litter trays, you can see me and an animated cat, Beryl, who can talk you all through it all.
I am actually going to check it out, definitely. But it's interesting because there's so many things that you've just said straight away that I think, oh, okay, I can just double check that and make sure I'm getting it right,
Definitely. And same for everyone else listening, like there's so much stuff that can be done, which is great, good news.
Yeah, and also it's interesting that you're saying if the cat's doing it near the tray, they do want to actually get in. So it's not like she's going somewhere completely elsewhere in the house and she's resisting the litter tray. She wants to do it, but there's obviously something that's not quite it's not quite right.
Not quite right.
Get my detective hat on and
exactly.
Exactly. There we go. That's a full-time job for me to be getting on with, isn't it?
Like I say, vet check first. And then the other thing to just quickly mention is it's really common for people to think it's a dirty protest. It just doesn't exist in cats. No. That's the short answer. That's not where their mindset's at.
No, they're too proud, aren't they? They just won't do it, cats. They just be like, no.
Yeah, and so much stuff, it's not about us. It's just, like I said, it's all about the litter tray and setup and where it is. And yeah,
well, that's made me feel a bit better about it now, Nicky. So hopefully, if I do a little bit of, like you say, detective work, I think things will improve. I mean, it's not a lot. It's just every once in a while I'll notice it. So making me think maybe it is something about the tray might not be clean enough at that point, or like you say, it's wooden litter, so it's them quite big chunks, but she does tend to prefer that to other ones. So I'll do some digging about, not in the litter tray. No. I just mean in terms
good to clarify.
Just in terms of some detective work. So Nicky, of course, as always, you're going to be on hand to answer any queries that we have and offer some advice on any cat-related questions that are coming in. But obviously, we've got today's guest as well.
Yes.
Becoming a bit of a recurring thing for the end of series specials that we do. So I have someone else who is very well qualified to answer questions that have been sent in to us on the podcast. So shall we do it? Shall we get him in? So as you probably know by now, each week on Cat's Got Your Tongue, we're joined by a guest who adores the cats just as much as we do. However, today's guest probably knows a little bit more about pets than most of us. You might have seen him on TikTok and Instagram, and what is now becoming a bit of an end of a season tradition, we've got another vet on the podcast, Dr. Ben Simpson-Vernon. Welcome to Cat's Got Your Tongue.
Thanks very much for having me.
We're really excited to have you actually, mate. Because it is becoming a bit of a end of series tradition, isn't it, Nicky?
Yeah, definitely. And we always appreciate having the vets on board.
Yeah, that's it. Just to kind of get an even kind of more in-depth kind of take on some of the questions that have come in from listeners over the course of the series. So obviously, let's get into finding out a bit more about you, I suppose, Ben, and some of your credentials. Obviously, you deal with cats all the time, I imagine. So you're pretty sort of well versed in the world of cats, shall we say?
Yeah. I mean, I always had cats growing up. We had the first cat I had actually was when I was very young, so I don't remember. It was a cat called Dumper. That apparently was named Dumper because he did a poo on the mat as soon as he came out of his carrier when my mum and dad brought him home. But Dumper was the first of a sort of series of cats that we had. There were always cats in the house when I was growing up, and and then obviously I work with cats every day of my working life.
God, what an unfortunate first action for the cat. You know what I mean? For him to get his name from that.
Yeah.
So have you had other cats since then, or is that kind of your main experience of owning a cat?
I had three different cats growing up. I had another cat called Doris. She lived till she was about 15, I think. And so she was around for most of my sort of, until I was in secondary school. We had another cat called Bubbles who was around till I was about 15. And I don't have any cats at the moment.
Would you maybe looking to get one potentially?
Potentially.
At some point?
I mean, I think that's the thing with working in veterinary. There are always opportunities to take on cats, and you have to stay strong sometimes.
Definitely.
And, I mean, at the moment we've got 2 young children, and they kind of take up a lot of our time. It doesn't feel like the right time to get a pet. But I think as things ease off, we've got a 1-year-old and a 3-year-old, so we've got our hands full at the moment. As they get older.
I'm not putting pressure on you. You're at the right place. Actually, is somebody available cats currently?
Well, we might take on a cat. My wife's grandma has a cat called Posy, who's she's quite elderly. The cat and her grandma, obviously, but she might be going into a sort of residential home where she can't take the cat with her. So we may end up taking the cat on. So possibly in the near future.
It's one thing that's always kind of fascinated me as a cat lover and enthusiast, and something that I've often talked to you about, Nicky, is cats' temperaments kind of vary so much. So as a vet, what are cats like to deal with? Because I find even a simple thing like trying to get my cat into a cat carrier to be quite difficult sometimes. So what's it like actually dealing with cats day to day? Are they unpredictable? Like, have you got certain techniques that you kind of use, or is it just the experience kicks in?
They can be. I mean, I think a cat, on the whole, cats are more challenging to deal with than dogs, I would say. I don't know how you feel, Nicky, working in practice, but I think the thing with a dog, once you've got a muzzle on, you can be pretty happy that it's not just the teeth with cats, it's the claws as well. So I think, everything we do in practice, do everything to try and minimise stress for cats, and I think that's quite key to making it a more pleasant experience for them. No cats, they don't like coming into the vet practice, and when they come in, they're normally being stabbed with a needle, or a lot of cats don't like being prodded and poked and having their tummy felt and thermometers shoved up their bottom, understandably. So it's we just do what we can to make it as pleasant an experience as possible. But all kind of techniques, using pheromones, using towels to handle cats that are a little bit more fractious. But there are ways and means of dealing with some of the more challenging cats.
Have either of you guys ever come across a cat that actually likes going to the vet?
My cat's all right with the vets.
Really? What do you know all right with it? Just like...
Well, I sort of socialise with myself, and this is one of the things we recommend to clients, particularly if they've got young kittens, is getting them used to being handled all over, getting them used to the cat basket, making it seem like a safe den. And so I did all of that with my cat when he was in the socialisation period of 2 to 7 weeks. I'll admit, the pressure was on.
Oh, yeah.
You know, the vets knew, I'm a nurse, I'm a behaviourist, and so they're like, see how this goes. But for his first booster vaccination, he sort of just strolled out the cat basket, and then he just went and lay on the cat scales, and I was like, yes. And they're like, oh, he's really good. He's really chilled, and I was like, yeah.
You're like, it must be a natural.
Yeah, exactly. But in my head, I'm like, phew, it's such relief. But it's nice to see that, having done all this work, it makes a massive difference. He's fine with fireworks. When they were kittens, they used to be a bit too familiar with a hoover. If you're trying to do the stairs, they try and bat it, and So it makes a huge difference.
It's quite rare, though, is it?
It is, because I think most people don't know much about kitten socialisation. Whereas if more people that did it, and obviously all cats protection kittens are socialised. So
yeah. I think it's a real mixed bag, and you definitely notice on days where we seem to have days where we get a lot of upset cats, and I think they pick up on, must be pheromones and signals from other cats that are in the practice, and then one cat will start hissing and spitting and not being very happy, and then the next cat you go to handle will be very similar. So they absolutely pick up on those kind of signals.
This might sound like a stupid question, but obviously my cat was a rescue, so I got her when she was 7. So is it too late to get her sort of at ease of going to the vets and that kind of thing? Is it too late to kind of teach her those skills? Because obviously she doesn't like to go into the vet, being handled. She's liable to hiss and that kind of thing. So I feel like it'd be harder for me now to kind of almost not retrain her, but I don't know what the right term would be.
That's right. Yeah, so it is harder than doing it when they're kittens. It's also a completely different process. So rather than socialisation, and none of these words roll off the tongue, it's desensitisation. So it's a completely different process in the brain and everything. But it's getting something they're a little bit scared of, or very scared of, and really, really gradually expose them to that scary thing. at such small levels, really slowly over time at that cat's individual pace. So the triggers will be different for each cat, but like people have got different triggers for things they're scared of, and working slowly towards it. So for example, like if she's not scared, if she's a bit scared of the cat basket, you'd maybe have it out but quite far away from her normal bits and pieces. Make a safe den out of it, have got thick blankets in that smell of her. And then rather than sort of bring it to her, you wait for her to go to the basket and then give her treats and things to get a positive association with the basket over time.
Yeah. Oh, that's quite interesting to see.
So it can be done, but it does take sort of weeks, in some cases months.
Yeah. In terms of common issues that you sort of see with cats that you treat, Ben, is there like recurring things? I know when we had Dr. Bollow on at the end of season 1 on the podcast, he mentioned a lot of dental issues that tend to go under the radar quite a lot. People don't realise just how important it is for cats.
Yeah, I think a lot of people, such a common misconception that we hear all the time in practice is, oh, he's eating, so his teeth are fine, and particularly if often we pick up on dental problems in a routine examination because their teeth have to be really quite awful for them to stop eating or even show like obvious signs of mouth pain. There are often subtle things that you can pick up if you know what you're looking for, but it is often on routine checks for vaccinations that we find dental disease. And dental work is not cheap, and so it can be sometimes a bit of a, we have to really convince owners that dental disease is a problem for their cats. But I think people, because they are of the idea that they're eating, so they must be fine, you have to make people, we'll see cats that have multiple teeth that are hanging loose and severe ulceration in their mouth and that bleeds when we touch. If you think how painful a mouth ulcer is when you have like a small mouth ulcer, some cats that we see, particularly there's a problem that cats can develop called stomatitis, where their immune system overreacts to plaque on their teeth and they can have the most horrendous sore mouths. But sometimes we'll pick up that sort of thing just incidentally, or their owners have only picked up that they've got smelly breath but no signs of pain. So I think it's just being aware that cats are just masters at hiding pain, and it's an evolutionary thing that they don't want to be seen to be vulnerable, so they just kind of get on with things.
Do you ever find these things that cats come into surgery and it's kind of things that are fairly easy to avoid for cat owners, but as a cat owner sometimes, like you say, it's quite hard to, if you're not qualified, to pick up those things. So is there anything that cat owners can do to kind of avoid things that you see quite regularly? I mean, they might not be, but I'm just thinking, is there anything that happens with cats quite often that you think, actually, a little change here or there might actually be able to avoid it?
Well, I mean, talking about a dental disease, definitely introducing a toothbrush to your cat when they're young and making it a positive experience is really important. And, not only is it a good thing for your cat, people often ask when their cats come in and they have loads of tartar on their teeth and a sore mouth, say, oh, why is that? And it's because they don't brush their teeth. What would happen if you didn't brush your teeth for your whole life? So really important to at least give it a go, trying to introduce a toothbrush at a young age. But I mean, other things that we see all the time, particularly this year, it feels like every other cat that I see has fleas, and cat owners often just don't realise. And I think cats often are quite tolerant of having a large number of fleas. Will sort of pick up quite quickly on an examination that they've got the flea. So I think a good thing to get into, it's important to get into a good preventative healthcare kind of routine really, and treat, if your cat is, particularly if you have an outdoor cat, they're going to be coming into contact with other cats and they're going to be at high risk of picking up fleas. So it's a good idea to think about treating your cat routinely every month, every 3 months, depending on the flea product. Because once you get fleas in your house, they can be a nightmare to get rid of. And
you need the right product to use for the house as well. Yeah. Are you seeing a rise in obesity at all with cats?
Yeah, absolutely. Definitely. Maybe last couple of years. I think increasingly, particularly with indoor cats that live quite sedentary lifestyles, I feel like we're maybe seeing more and more indoor cats, and I think perhaps correlated with that.
I mean, just to kind of touch on the flea, this might be a really stupid question. Fleas with indoor cats?
So, yeah, it is. It can be a problem, but I guess if you get a new cat and they don't have fleas and you don't have any other pets and there have never been any other pets, I think that's, if you have a free flea-free household and you get a new pet and they have no fleas, then there's a low risk of introducing fleas. But yeah, if you have an indoor cat, low risk of introducing fleas to your household. So not every cat needs monthly flea treatment. It really depends on think about the risk.
So let's look at some of the kind of positive aspects of being a vet as well, then. Is there any, kind of stories or experiences with cats that you've had that are just kind of really sort of ingrained in your mind, or is there any kind of anything you can go into in a bit more detail with us? Is there a certain cat that really kind of sticks in your memory or that kind of thing?
Before I came on the podcast, I was sort of racking my brains of sort of cat experiences and funny stories, but it made me immediately think about. I went on a trip to so I volunteered at a cat neutering clinic in Malaysia when I was a vet student for 2 weeks, and it was just the best experience. And it was a really useful experience for me as a student. And I went with Jess, my wife, who's also a vet, and we had a great time, and we learned a lot. We learned a lot of it's quite hard to get experiences of surgery as a vet student, and so it gave us brilliant experience of that. But it was just funny. These cats. There's a huge problem with stray cats on this island, which is called Langkawi in Malaysia, and so we would go to a wet market with fish, I think, from the kitchen. So this cat neutering clinic was in this luxury hotel. On the side of it. So the lady that ran this cat neutering clinic also ran this hotel, and we, as a perk of staying there, we got to stay in one of the fancy rooms for 2 weeks.
That's amazing.
But we, so we would get food from the kitchen. I think it'd be from the kitchen in the hotel, and then we'd go to a wet market and have to capture cats. So we'd go with all these carriers, and we'd have to. It would normally be the slightly more socialised cats that would obviously come closer to us, and then we would manage to get them into a carrier as calmly as possible, take them to the practice, and then so that they would know in future which cats were neutered, would sort of ear tip them, so just cut the very, very, very tip of their ear off, just so they could identify which cats had been neutered.
Yeah, whilst they're under anaesthetic.
They're under anaesthetic, I should say. But it was just a great experience, and it was just funny. This hotel where we were staying, it was just sort of overrun by cats.
I remember the perfect place to stay to me.
Oh, yeah, doesn't it sound amazing?
If you like cats, though, I think that's the key thing. I remember looking up a TripAdvisor review, and the headline of their review was, "If you don't like cats, don't stay here." It was brilliant.
Adam adds to favourites.
Exactly. I'll put the details of that one later. Yeah, definitely. So another thing that I've heard is that you're going to be on the judging panel for Cat of the Year at the Cat Awards this year.
Yeah.
Amazing.
So it's just like the best day ever. It's like the Oscars for cats. It's just, honestly, it's amazing.
Yeah.
So are you excited for it?
Yeah, I am. I wasn't a judge last year, but I did go to the awards ceremony, and it's just a really fun event, isn't it? I left at work about half an hour early or something to get there in time, and I was sort of telling people, I'm going to a cat award. So the cats actually get the awards? Yeah. That's brilliant.
Yeah, I think a few of my friends were confused. They were going, so I was like, no, it's not cats in tuxedos before you start. It's not that. I said, there's no cats actually there. But some of the video montages, I always say to Nicky, honestly, like, they just...
The first year
I went, I just thought the room was dusty, but it wasn't. I was going a bit, I'll be honest with you.
Everybody does though.
Yeah, I know. And I didn't think I was going to. And then the following year, I was like, well, I'm prepared for it now. And then it happened again. And I'm just like, it's so emotional. But it's such an amazing and really inspirational as well, isn't it? So, what you're going to be looking for in terms of, Cat of the Year as a judge, you're going to be quite a harsh judge, or?
No, I think you can't be harsh at this kind of thing, can you? I think it's... I think I remember there was last year, there was a cat that I think there was a lady that was diabetic, and the cat was sort of signalling when she was having a hypo, and it's just amazing.
It really is.
I had no idea that cats, obviously they're so perceptive of their surroundings and pick up on signals that we're just not aware of at all, and it's just absolutely incredible.
Yeah.
It'd be great to have more research in these areas, wouldn't it?
Yeah, because I know they have sort of like service dogs
medical detection dogs.
Medical detection dogs and dogs that do, I think it's more something that there's more awareness of with dogs, particularly like with diabetic owners. But I wasn't aware that cats could.
Yeah, I think I'm seeing more, especially on social media, like cats as like support animals a lot more now for children and that kind of thing. Yeah. You see a lot of that now on TikTok and Instagram and that kind of thing. And, I always think that, it's such a great sort of gateway for a lot of children to learn a lot about society and the world and just control their emotions, really. So, because I think it was always like more of a dog thing, wasn't it? But now I think I'm seeing it more with cats. Is that, and sometimes people have this perception of cats being very aloof and, they're not interested in that kind of thing. But I don't know how, when you see like things you see at the cat awards and you start questioning things that you do you know what I mean? I'm thinking, well, maybe they are way more aware than we think, and I would say there's obviously still ongoing research with a lot of these things, isn't there?
And I think for some cats that are being slightly aloof, actually for some children that's what they need.
Yeah.
And they need something that's not too intense and, like with eye contact and things like that. I think for some children that actually works in their favour. So with all these relationships, it's all very unique. So it's about getting the right match for that particular child. And it's when the cat awards, that's when we're seeing those amazing relationships, and it just works beautifully. And it's what's nice is it's a sort of symbiotic relationship for both the cat and the child, and all the owners of all the other different stories that we hear about. But it works for both parties, and that's what's so heartwarming about it all. Yeah.
So we're looking forward to seeing you at the Cat Awards this year, Ben. So
can't wait.
Now, before we get into our regular feature and we get some questions to you, Ben, that have been sent in by our listeners of Cat's Got Your Tongue, have you got anything coming up? Tell us a little bit more about your social media stuff as well. TikTok, it's just gone crazy for you, hasn't it?
Yeah. It's I focus a lot on sort of welfare issues, and I've worked a bit with Cats Protection on trying to work on raising awareness of, particularly I talk a lot more so with the dogs, trying to raise awareness of health problems that are specific to particular dog breeds, but I think we're seeing the popularity of pedigree cats increasing, and there are some of those pedigree cats that do have some extreme features, so particularly the Scottish fold cats that have the folded ears, and I've been sort of working a little bit with Cats Protection to try and raise awareness of the health consequences of that. A lot of people don't realise that so Scottish fold cats, they have those folded ears because the cartilage in their ears is defective, it's weak, but it also means that the cartilage in their joints doesn't work properly, and so many Scottish fold cats, all of them to some extent, develop painful arthritis at a young age, but I think that they're all over social media, and there are some big name celebrities that have them, and I think people just aren't aware of those issues. So I try and raise awareness of those kind of things.
Is that brought on by breeding as well, or is that just a natural with that breed?
I mean, it will have likely arisen initially as a naturally occurring mutation, but then we've sort of maybe selectively bred to exaggerate it, and then often these mutations come with sort of side effects, I guess, or unexpected other effects on the body and increased disease risks of various problems. Yeah.
So what are you hoping to kind of do next? To just kind of keep building your socials and keep kind of giving information?
That's it really. I mean, I think initially I started it during COVID, and I didn't really expect it to kind of grow as it did, but I think it was initially kind of borne out by frustrations in practice, seeing Scottish fold cats and then developing arthritis, and then people not being aware of those problems, and particularly more so with the dogs, like the flat face sort of breeds, like the pugs and French bulldogs, and feeling a bit helpless to kind of help educate people in practice. And I think social media is just such a good tool to educate particularly young audiences.
So before we move on to our second part of the podcast, something that we usually kind of speak to our guests about is, when you communicate with cats, do you have like a different voice that you use? Because I do.
I think
even in surgery, I suppose you've got to keep some kind of, air of profession,
or an out the back voice then.
Yeah. I think it's just like a baby voice. It's like talking to a baby really, and normally, same way I would maybe have talked to my son or daughter when they were like a few months old, and I think it's just a sort of, just a sort of
a slightly higher pitched voice.
Yeah, slightly higher pitched, slightly softer. Don't worry, it's okay.
Yeah,
it's okay.
The thing is, and I think the more like episodes we've done, and the more people we spoke to about it, like people have gone, well, it'd be quite weird. Like if you look at a cat and how cute they are, it'd be weird just to be like, all right, mate. It's strange. Like you can't communicate to a cat just by being ultra serious. I mean, just something about looking at a cat's face just melts me a little bit, and then I've suddenly become a completely indistinguishable cat person to and I'm sort of Monday to Friday. Do you know what I mean?
Yeah.
So I'm exactly the same voice for me as well, Ben. So yeah. So some great advice already from Dr. Ben. He's going to be staying with us because next on Cat's Got Your Tongue, we're going to be going through loads of your questions. It is time for your cat's tales as sent in by you. Welcome back to Cat's Got Your Tongue. It's now time for your cat's tales. You've been sending in questions and dilemmas with regards to your cats, and this is where we get to hear from you. It can be anything really, feline disasters, success stories, questions that you've always had about your cat, anything cat related really. We're here to help, and we've got an extra person to help us as well because Dr. Ben is here with us. So I imagine between you, Ben, and Nicky, there's nothing really that can, no pressure by the way, but there's nothing really that can throw us. I'm not including myself in there, so the pressure's firmly on you two.
It's great to have a behaviourist. It'd be useful to have a behaviourist with me alongside me in every consultation, to be honest, because that would be amazing.
It's like the dream team.
Yeah.
Well, that's what you need in practice. Yeah, the dream team, isn't it?
Yeah, absolutely.
Yeah.
Okay, let's get into this because we have got a few to answer. So Phyllis has sent us a question. And Phyllis says, how can I persuade my 10-year-old cat who I adopted a year ago to sit on my lap and enjoy a cuddle? She occasionally snoozes on the bed, but if we try and pick her up, she struggles and hisses, but she doesn't bite. I've had cats all my life, but none as unaffectionate as this. So I think for cat owners, this is something which, I don't know, it's bad, but I think that sometimes you just want your cat to be affectionate, and it's quite hard to accept sometimes. But you often, if you get a rescue, I imagine that it's quite difficult because they might have gone through something which you're not aware of, and you'll often, when you see on the Cats Protection website, it'll sometimes say not a lap cat or loves a cuddle, that kind of thing. So can Phyllis change that? How does it work? Or is it just like, listen, you've got an affectionate cat? Sorry, Phyllis.
So first and foremost, I always like to defer to the vets because you need to get a vet check and rule out medical problems. So Ben, on the medical side, what do you want to check out?
I guess if it's particularly when the cat is being picked up, you'd want to check that there's no source of pain, and that's not, because often a lot of behavioural problems stem from pain. And so particularly, if she's 10 years old, she could be starting to develop a bit of arthritis. Maybe she's got a bit of pain around her hips, or it's just changing position is a bit uncomfortable for her. So I think definitely worth a vet check. But yeah, I mean, some cats are just not lap cats, really, are they?
Exactly. So then it comes back to the behaviour after it's been to the vets. And so one, it could just be who that cat is. Two, I would say that she needs to just lower those expectations, which is really hard.
It's tough. I know. It's really tough.
We know what it's like. It's really hard, but she needs the kind of almost treat them mean, keep them keen attitude. I know, but that's what people resonates with people when you say that. They kind of get it and okay, so just ignore the cat. If anything, be busy. Like if you're on the phone or you're on the computer and that's when the cat comes.
Yeah.
So it's avoid, but what you're doing naturally is avoiding eye contact. If you make yourself quite small because you're lying down on the sofa or something like that. I mean, I think the best one is lie on a sofa, watch TV so you're busy, and then get one of those really fleecy throw blankets on you.
Yeah.
It just feels good under the claws, and ignore the cat. And if the cat jumps in the lap, obviously have an internal party, but don't really express it. Don't just start fussing. Just ignore. It's really hard at that point to then be hands off and just let it happen.
Yeah.
But just be really excited internally and then it has to be done at the cat's pace. So picking the cat up is understandably not what the cat wants. So,
yeah.
But I think it is managing your expectations, because you're probably never going to end up with a cat that is going to be kind of sitting on your lap all day happily. And I think if you don't really know the history of that cat, perhaps they just weren't socialised at all with humans. They were astray at a young age. Then it's very obviously, as Nick was saying, they can be desensitised, but that socialisation window is gone. So there's sort of limitations to what you can achieve.
Yeah,
definitely.
It's strange though you say that, Nicky, about that kind of almost avoiding it, because when I got Ruby, my cat, we were told she's not a lap cat and she'll never be a lap cat kind of thing. So she'd probably, I don't think she'd ever sat on anyone's knee before. I knew she'd quite a tough start in her life and that. So I kind of went in with no expectations. I'd never had a cat before
Which
either.
is great.
So,
that's what you want.
Yeah, I almost kind of resigned myself to the fact that she'd probably never sit on my knee. So I never really encouraged it. I never did now I'm like, tapping my knee all the time. Come on, please, yeah. Because I know she's got it in her to do it. But at the time, I didn't know she was going to. And then it just happened.
Exactly.
So, yeah, and the more she became comfortable with me and, the longer she lived in the house and the more she wanted my attention, and then slowly but surely, then it became just a a paw on me, and then I was like, oh, is she going to do it? And then it'd be 2 paws, and then it just like you say, it's a slow kind of process. But now, can't get her off my knee. She loves it. So
exactly, and it's like having that relationship with them, like knowing that can build up over time. It's not a guarantee at all. Some cats, even though this one's 10, even when they're older, some cats can still potentially change and become a bit either clingier or a bit friendlier. But again, it's really not a guarantee. I had a cat that I'm pretty confident was a bit poorly socialised, like still a pet cat, but just a bit more timid naturally. And I think she was about 15 or so when she finally slept on my lap, and that was only because I was so poorly. I was like, when you're just on the sofa and you're ill, and again I had the blanket, and she did step onto the lap, and I was like, do not touch the cat. And but that week I feel like it changed a corner for us. And,
yeah.
But it's just one of these things, it might happen, it might not.
Yeah, you just got to be patient, I think, as well with
it.
Another question from Alex, Janie, and their cat Coco, who they say, we batch make a lot of our family meals in advance, usually freezing them. As good cat food can be expensive, I was wondering what you guys thought about making our own cat food. What do we need to consider and make sure we include if you wanted to do it so they get the right nutrients? Is it something which, I think a lot of cat owners are probably, you want to give the cat the best you possibly can, and you hear a lot of things about raw food, and to be honest, I don't know what's best really.
It's really difficult to create a homemade diet without specialist input that you can be sure has got the right balance of nutrients to your cat. Cats have very specific requirements for nutrients that our bodies can make. It's not like feeding a small human. There are some amino acids that they can't make, taurine, another one called arginine. They can't synthesize any or limited ability or to produce vitamin A, vitamin D, and other nutrients. So I would, if you're really keen to make a home cooked diet for your cat, then I suggest getting a veterinary nutritionist on board, and your vet can probably refer you to someone to formulate a diet for your cat if that's something you're particularly keen to do. But that's probably not going to be a cheap thing to do. Getting the diet formulated, and then obviously it's still not going to be cheap to make a homemade diet, and it's quite a time investment as well. So I think in most cases it's just not worthwhile, and there are so many options for different cat foods on the market.
Completely agree. And I'd also just add that probably the easiest thing for the average cat owner to do is actually just speak to your vet, and they're best placed to sort of advise on different types of diets that are available, and also for the particular life stage that cat's at, and also if they had any particular medical conditions. Sometimes there are particular prescription diets that are suitable for that particular condition. So I'd say really just speak to your vet.
I mean, there was a lot of focus on raw food that seemed to be like a very sort of on trend thing almost a couple of years back, and it was you'd see a lot of people on social media kind of saying, well, I mean, even me as a non-expert, I knew that it wasn't right, because it was like, well, this is what cats would eat in the wild, and it'd just be like giving them like good quality meat, and that was it almost. Do you know what I mean? Because it's like, well, this is what they'd have eaten back in the day, and it's like, well, they're not exactly the same as a tiger. Do you know what I mean?
Yeah.
No, I mean, again, it comes down to that, making sure it's a balanced diet. There are commercially prepared raw food diets, and some cats anecdotally do well on a raw food diet, but there's just not really the evidence to prove that it has significant benefits, and there is evidence of the risks of feeding a raw food diet, particularly with, for not necessarily just for the cat, but also for the people in the household. If you have anyone that's immunosuppressed or small children, obviously there are risks that come from the raw meat, and then being in contact with your cat that's been eating raw meat. If your cat then licks you and has raw meat juice in their mouth, then you can pick up infections, or children can pick up infections. And there are some infections that cats can also pick up from raw meat that they're much less likely to if that meat has been cooked. And so I would just say the risks outweigh the benefits, in my opinion. I think a lot of vets are generally of that opinion. I think there's just not enough evidence at the moment of the benefits of raw for me to justify recommending it to my.
I think it's one of those things
clients.
which you sort of like. It sounds like a good idea on paper. Do you know what I mean? Like you feel like, oh, the cat's part of my family. I want to like
cook for them.
Do you know what I mean? Because you want to like do everything for them, don't you? But it's just I
think that's like one way that people can show love, demonstrate love for their cats, and so they're really eager to make sure they're feeding them the right thing and they're doing their best. But you just have to be careful.
Yeah.
Save it for birthdays.
Yeah. Special occasions, like that cake that I made for my cat. Yeah. No, a cake made out of fish, by the way, Ben.
It's basically just fish.
It was it was just very, very high quality fish in the shape of a cake with a little candle on top.
So we did that for my wife's family. Had a cat, Muffet, who she lived till 20. I think it was her 20th birthday. We made her a little cake, but it maybe wasn't as elaborate. Just some cat food and some kibble biscuits sort of in a happy birthday.
Yeah, honestly,
some prawns. Prawns.
Yeah, I've already got it's a birthday in October, so I've got like an idea in my mind of how we're going to do it. I'm thinking of toppings this time as well. The sort of the yogurt. I'm going to put that as a little topping on, and maybe sprinkle a few dreamies on top as well.
One that doesn't contain lactose, though.
Yeah.
Do you think Bake Off could do a dog and cat cake?
Get me on as a judge, definitely. That would be amazing. I would. Oh God, I'd be a man for that. Right, let's move on to another question sent in on WhatsApp from Spencer and Jazz, and they say, "Hey guys, we inherited a rescue cat who seems to have settled in really well and uses our garden and sits outside happily. The only thing is, he doesn't have a tail. We heard it had been lost in an accident a long time ago. We're wondering if it affects him in any way, or if other cats respond to him differently without it. We've never come across a cat without a tail before." It's a really interesting question because, whenever I've looked at, anything to do with sort of cat behaviour, you can read a lot from a cat by its tail, can't you?
Yeah. And there's loads of research to show that actually cats use their tail an awful lot in signalling and so communicating with each other, even to the point that there's some research done where they just put a black silhouette of a cat, so it's just a sticker effectively or an outline, and the cats from afar would put a tail up and then mimic it, and it's only when we got closer they're like, oh, it's not real. but it's that good distance communication to try and be like, I'm friend not foe, or at least I'm no threat to you. And so the other cat to signal that back. So I do think with cats that don't have tails, there is that element of it's going to be tricky for cats to be able to to read other cats and get the correct communication going on.
Is it going to be something that would affect the cat quite badly then?
It's unlikely, and I mean it can also. They do use their tails to balance. So I suppose if they're an outdoor cat. Maybe, I don't think there's any evidence to prove it, but I don't know, possibly they're maybe more likely to not be as agile climbing over fences and things like that. But I think cats are quite adaptable and usually will adjust to those kind of changes. But yeah, definitely the tail is something that we definitely in practice working with cats, often the first sign that you need to be careful with a cat, they're not very happy with the situation is a swishing tail. Yeah.
Which is obviously something, I've got like friends who've got dogs, and when a tail's wagging, it's like, oh, they're excited. And I'm like, it's not quite the same with a cat though. It's like, just be aware if the tail's going, generally, they're not very happy.
No, definitely had that. People say, oh, he's happy. Tail's wagging.
Oh, cats are not small dogs though.
Yeah. Next thing you know, he just hissed at me. Why? Yeah, you tend to do that. I suppose it'd be, for Spencer and Jazz, it'd be harder for those guys to read the cat as well, to an extent, because, even my cat, she loves me, I love her deeply. But even now, there will be the odd time when the tail's going, I think, okay, she's had enough now.
Yeah, and they're going to be to adapt themselves and be like, right, get really keen on reading like the pupils, like whether they're dilated or smaller, and the ears, what the ears are doing, if they're turned out. And even whiskers, if you're getting really keen, like whiskers in a neutral position versus when they come forwards, whether they're pressed back. So they can all mean different things. And the main thing is there's no like, this means this and that means that, because a lot of it depends on the context. So for example, like if they're bringing the whiskers forward and there's another cat that they don't like, it's because they're anticipating attack, and their whiskers will be the first thing to kind of really feel that. But equally, in play, and they're excited, they can bring the whiskers forward again to sort of feel for the toy. So it doesn't always mean it's a good or bad thing. It depends on the context.
Yeah, I suppose it'd be just the main kind of downside will be that it's harder for the humans to read, because, like you say, cats are very resourceful, aren't they?
Yeah.
So in terms of how they adapt to anything that changes in their bodies, they're just unbelievable at that, aren't they?
They're
really?
so good. And they just basically crack on.
Yeah, just get on with it.
Yeah. Even, I mean, talking about limb pain and stuff, cats are surprisingly adaptable to having limb amputations as well, and will still manage, even climbing fences and going outside with amputations, and live a very full life. And we have often the kind of scenarios where we amputate limbs in practice will be if there is a severe fracture that is not amenable to be fixed, or there are financial barriers to fixing the fracture, then an amputation is something that we consider. And people often worry that their cat's going to really struggle afterwards, but they're so adaptable.
Yeah,
they really are. And it's often even just like the most pragmatic option as well. It gets the cat literally back on their feet quicker and less painful than fixing it as well.
Sometimes it's something we'll recommend, even if finances are not necessarily a restricting factor and someone's well insured, then there are some fractures that are just such a high risk of complications if they're being fixed, that amputation is sometimes just the right thing to do for the cat.
So Ben, I mean, we had so many questions that we'd love to throw at you, but we've got our last one here. This comes from Fergus, who says, guys, I have 2 cats from the same litter. They're nearly 3 now, and I've always lived together and get on fine. My question is, why do they smell so different? One smells so sweet and silky, absolutely gorgeous, and the other smells quite unpleasant sometimes. They're neutered brothers who live in the same house, and I think do pretty much the same thing, so why would they not smell the same? I know that's on the surface, it sounds like a bit of a bizarre question, doesn't it? But I kind of get where it's coming from. It's quite an intriguing question.
Especially as a cat sniffer.
Yeah, it's no secret. If you listen to this podcast regularly, I regularly will sniff my cat.
You're not alone, Adam. That's fine.
When I first admitted that, Ben, on this podcast, I thought people are going to think I'm so strange. And literally, I was backed up. I think it was Caroline Quentin.
Yeah.
It was like, oh yeah, we all do it. I was like, oh, thank goodness, it's a safe space for people that sniff the cats.
It's like being a wine connoisseur.
Getting hints of dreamies. So. I mean, have any of you guys come across this before? Is there any sort of scientific explanation behind it, or any insight you can give us?
I mean, most cats don't smell. Cats are really good. They're very fastidious groomers. They're very good at keeping themselves clean, and most cats don't need to be bathed. It's quite a common thing. People will ask. They'll come in with a kitten and say, "Oh, can I give him his first bath?" Well, you don't really need to. Most cats don't need to be bathed, and they can keep themselves clean. I would say, there are some medical issues which can cause a cat to smell. Often it's dental problems, and they're young cats, aren't they?
So nearly 3.
Age 3. So that, I think I'm talking earlier about this mouth problem, stomatitis. That is something we do see in young cats that haven't necessarily built up lots of tartar on their teeth. Their teeth are relatively clean, but they can have really severe gingeritis, and alongside that comes an overgrowth of bacteria in their mouth, which smells. And so I would definitely say take the cat to the vets to get them checked. But
skin conditions, like certain skin conditions can have a particular smell.
Yeah,
you certainly get to that point where you're like, you smell it and you're just like, oh, it's going to be this.
Yes, and ear infections, pseudomonas ear infections.
It's got a specific. Yeah,
for sure. I think definitely take the cat to the vet to make sure there definitely isn't a medical reason. Cats like dogs do have anal glands, which are scent marking glands inside their bottom that they will intermittently release. And I think some anal glands smell a lot worse than others. Usually it's dogs more often that we have to routinely empty anal glands for some dogs at the vets. Some don't smell that bad, some smell absolutely horrendous, and I think it's the same with cats, really. So that could be a source of an unpleasant odour. Yeah,
and maybe like urinary or fecal incontinence.
Yeah.
I mean, it'd be surprising in a younger cat, but like you say, to take them to the vet and get everything, full MOT, and explain that you can make it's a strange smell. I
know what you mean about like cats in general don't tend to smell. There's a brilliant video that I've seen on Instagram Reels where it was like there's sort of a video of like a woman with this like luxurious hair, and she's like thrashing it about, and it says like, you know, shampoo, conditioner, all these things, and then it just cuts to a cat and just says saliva, and the cat's like this glorious long-haired cat and the best fur you've ever seen in your life. And I think it's weird as well, because when I say to my friends that my cat smells amazing, and there's something very comforting about smelling a cat. That you won't. It sounds crazy saying it, but if you're a cat person, you know what I'm saying. And I think, how does my cat smell so good when the food she eats is disgusting? Like, the food, it doesn't smell great. Like, do you know what I mean? And her tongue's so rough, and it shouldn't make sense. It doesn't make sense, but it just does. And they're just ultra clean animals, aren't they, as well?
Yeah. It's that rough tongue that really helps them to groom themselves well, and the barbs on their tongue. I mean, you'll notice if your cat licks your cat has ever licked you, how abrasive their tongues are. It's like sandpaper. But the little barbs on their tongue help to wick saliva down into their coat, so they get down into the deeper layers of their coat. So that's sort of partly why they're such effective groomers.
I've noticed as well, my cat will often clean straight after food, and obviously straight after going to the litter tray.
Yeah. So cats have got like a full-blown, and I love the fact that people get to study this as well, a full-blown routine in grooming, and they tend to all start roughly in the same place. I think it's at the head and face, and then they literally work their way through their body, and it's a whole systematic thing. And like, but I want to say it's something like, is it 30% of waking time spent grooming?
Oh wow,
something like that, and that's waking time rather than like So it's a lot, and it's a big part of being a cat.
Yeah, I love watching my cat like having a bath, essentially. Do you know what I mean? It's brilliant. And she does this thing where she'll lick a paw, and she's obviously loading up with saliva, and then just like slicking all the fur on the top of her head, and she's got a real like routine that she does, and I know all the moves that she does, and it's just it's
I mean, that's amazing. 30% of waking time grooming. Can you imagine if we spent 30% of our waking time grooming?
We'd probably have time if we weren't like necessarily doing all the social media and things like that.
That's true. I'll tell you what, though, like next time you get a takeaway, you've got to go and have a shower straight after it. Do you know what I mean? If you're there going, that's what cats essentially do, isn't it? After the every single meal, she has to have a shower. Really,
that's so clean.
I know. Yeah, using a tongue, not an actual shower. I'd never
no, of course.
So yeah, Ben, thanks so much for coming in today. It's been absolutely brilliant. Something which we do tend to ask our guests, just to round things off quite nicely, is what do you think the best thing about a cat is?
I think their purring is just so soothing, isn't it? If you've got a content cat on your lap, just sitting on the sofa and having a purring cat on your lap, there's nothing more calming than that, really.
Yeah, my cat sat on my mum's knee for the first time a couple of weeks back, and like my mum's 60, and she was just, and she was like, oh my God, this is amazing. I was like, see, how good is it? And she's like, oh, I was like, this is the moment now where you become a fully fledged cat lover. So the purring is just phenomenal, isn't it, really?
It has healing properties. I think there is some evidence that the frequency of a cat's purr can help to promote tissue healing.
So it's true that cats are magic. There you go.
Oh, they're completely magic.
Ben, thank you so much for being with us today.
It's been a pleasure.
And thanks for joining us on Cat's Got Your Tongue. Any last bits of advice you want to give us before you go? Is there one sort of, if you could give like one sort of resounding little bit of advice to cat owners, is there anything you could kind of say?
I guess this is quite on brand for Cats Protection, but get your cats neutered. Particularly, well, if you have a male or female cat, but I see so many male cats in practice. I work in quite an urban area, and we see so many entire male cats, and I just try and encourage people to just realise, like, just say to them, how many babies do you think your cat is creating? And it's just so important as a responsible pet owner to get your cat neutered. So that would be my one big thing.
Yeah, thanks again, Ben. And that is it for this week and for the second series as well on Cat's Got Your Tongue in association with Cats Protection. Big thank you again to Dr. Ben for joining us today and answering all of our listener questions. Thanks to Nicky as well for being by my side with expert advice throughout this whole series. And thanks to you as well for listening and sending in all of your cat's tales. Remember to hit subscribe so you'll never miss an episode. Tell your friends with cats about us. Tell people who love cats to share the podcast. Give us a review as well, and we'll see you next time on Cat's Got Your Tongue. Cats Protection is making a better life for cats because life is better with cats. Whether it's finding homes for cats in need, offering advice to owners about neutering, microchipping in cat behaviour, or campaigning to make the world better for cats. If you'd like to donate towards helping more cats and kittens, visit cats.org.uk/donate.